Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
My name is Dr. Mitzi Williams, and I am a neurologist and multiple sclerosis specialist, and I've been doing that work for over 10 years. It's important to recognize that there are different types of stress. There is good stress that allows us to accomplish a task or kind of helps us get up the nerve to do something that we're supposed to be doing, like give a talk or do an interview. There is good stress that helps us to get out of dangerous situations. In contrast, there's what we call negative stress, and it's that type of stress that can be detrimental to our health and cause a variety of conditions, whether it is chronic headaches, stomach or digestive problems, or increase in depression and anxiety. So reducing stress or negative stress is important for everyone, including people living with MS. There are a couple of reasons why this is important. There have been several studies and much research that has tried to determine if there is a direct link between psychological or physical stress and multiple sclerosis. And I have many patients that come into the office and they say, Dr. Williams, I noticed my symptoms of MS after I had this car accident or after I went through this traumatic event such as a divorce, and did that event cause my MS? The honest answer is we really don't know. There is some research that suggests that there may be a link between physical or emotional stress and increase in MS activity, whether that be related to relapses or MRI activity, but there's still a lot of work to be done. And our research doesn't quite fit with what we see in clinic. So generally I tell people that we need to focus on stress reduction because it can temporarily worsen some of the symptoms of MS, but we don't yet have direct evidence that tells us that MS actually causes new brain lesions or causes relapses in the scientific or biologic sense. Although we still need more evidence about the biologic effects of stress on multiple sclerosis, I think that most people who treat and interact with people living with MS, as well as many of my patients, would agree that chronic stress does have a negative impact on the disease, whether it is related to new lesions or not. Certainly, we recognize that stress can increase some of the symptoms of MS and that some of the symptoms of chronic stress are very similar to what we see related directly to MS, such as fatigue or insomnia. Some people have headaches that may be related. And also, some people may have cognitive dysfunction or memory difficulty. And oftentimes, when we have the conversation about these symptoms, it's because a symptom may be worse and someone may be trying to figure out if it's related to MS or if it's related to chronic stress. Some of the conditions related to having MS that can increase stress are really receiving the diagnosis. So oftentimes when people are diagnosed, they're in the prime of their life, they may be finishing school, starting career, or starting a family, and this diagnosis can be devastating. So the diagnosis in and of itself can cause stress for many people. Also, if there are symptoms that may cause a change in their way of life, whether it's their ability to take care of their families or their ability to work and increase and take care of their finances, there are many different situations that can cause increased stress or chronic stress just related to MS itself, the diagnosis, as well as the symptoms that may be associated with MS. I help my patients with MS recognize the signs of stress by, first of all, helping them to understand that it is a normal response. I want people to recognize that in the midst of all of the regular stressors of life, having a diagnosis of MS on top of this can be an additional stressor, and that it's okay to admit that something new or something different is going on. Often the conversation will start when someone comes into the office and they say, Dr. Williams, my fatigue is so much worse, I can't function, or my memory is so bad that I can't remember what I ate for breakfast. And in some cases of advanced MS, this can be the case, but oftentimes when it is a very acute change, it means there's something else that's going on. It can be a relapse or it can be symptoms related to stress. So we try to kind of figure out what's going on in their lives, figure out if there's any outside influence that may be causing some of these symptoms to worsen. And that is what leads into the conversation about the effects of stress and how it can worsen some of those symptoms. Many people are willing to recognize that. Sometimes it takes a little bit more time. I also am a huge advocate of psychological counseling for all of my patients. And generally, I start that conversation at diagnosis. So when I'm sitting there kind of going through the diagnosis and the treatment, I often see what I call people's eyes glaze over because it's just so much information and it can be so overwhelming. And so because of that, I often recommend in the beginning, listen, I know that this is a lot. Let's pool all of our resources, including potentially psychological counseling, to see if we can kind of find a way to deal with this and kind of cope with this from the beginning, because either we deal with it or it deals with us. And so I start that conversation very early in my relationship with all of my patients. And so often later on, when those symptoms present themselves, it's easier to have the conversation about how to manage those and what's related to stress and what's related to the multiple sclerosis. There are many different interventions that can be potentially helpful to assist people in reducing their stress, and many of them are individualized. So it often is a matter of talking to that particular patient or talking to that particular person, knowing what their capabilities are, their time constraints are, and finding one that fits that person. Some of the ones that I regularly employ are yoga. I'm a huge advocate of yoga for a variety of reasons, because it can help with symptoms of multiple sclerosis, such as spasticity, also can help relax the body and bring attention to areas where we hold stress. I do a lot of counseling about the fact that many of us hold stress and tension in our shoulders or maybe in our back. And so at the end of the day, there may be symptoms of pain or spasticity that are worsened because we're holding that tension instead of releasing it in different ways. So I very commonly recommend yoga. I do also recommend meditation because it helps kind of clear the mind when people's thoughts are running with all the things that they have to do, or maybe all of the problems or issues that they're having. Exercise also is a huge help because it also helps our cardiovascular fitness, but can help decrease stress and also help release those endorphins to give us a boost in our mood. In addition, I recommend that people find things that they enjoy. So oftentimes when we get caught up in work, and when we get caught up in raising families, we may lose time to do some of the things that we enjoy, and just kind of picking up something that you like to do, whether it's reading or whether it is, going for a walk or spending some time coloring. All of those types of things can help release some of that stress that you have going on. And in addition, again, psychological services, if those are needed, and also developing a support network. This is key to successful living with multiple sclerosis. Like, it's important to have family members or friends or other people that support you, people that you can lean on for help. And it's also important to have some type of community of people who have MS, because as family members, as care partners, caregivers, we just can't understand in a real sense what having the disease is like. So it's important also to have some type of connection with people who practically understand what having MS is like and kind of the magnitude or the ramifications of having that diagnosis. I do have many success stories of patients who are effectively managing stress, but one particular one comes to mind. There's a young lady that I've been seeing for many years who is diagnosed with MS in college, developed a successful career as a healthcare administrator, and then decided to take a step back from that and move back home to Atlanta, which is our home city. And unfortunately, her mother passed away very tragically. And this left her with many responsibilities that she didn't have before, including caring for a special needs sibling, as well as just kind of dealing with the circumstances under which her mother passed away, which was very sudden and unexpected. And as a result of that, she went into a very deep depression. We spent a lot of time talking about counseling service, which she was involved in, but eventually she found joy in dancing. And so she'd never been a dancer, had never grown up dancing, but decided to take these dancing classes, primarily because she was having a little bit of difficulty with balance, and just found so much joy and happiness in going dancing with this class once a week. She advanced and gained some certifications in dancing, and now is advocating for other people with MS who are not just having difficulty with balance, but want to do something fun to help release some of that stress, to engage in regular dance classes. The main thing that I want people to remember after watching this video is that stress is a part of normal life. And having or exhibiting the symptoms of stress do not mean that you are some type of failure or that you are weak psychologically. But I think that the important thing is that once you notice those symptoms, it's important to learn how to manage that. So it's not just about knowing, it's about reaching out to others who are in your support network and reaching out to your healthcare partners and your healthcare team to try to learn to manage and support the stress before it has detrimental effects on your physical and emotional health.